The For Baby's Sake Trust has created 3 trauma insight resources for frontline workers supporting parents and children who've experienced traumatic events. This video takes you through the diagram and guidance for working directly with children. There's a parallel resource for working with parents, empowering them to meet their children's emotional needs, thereby playing a vital role in their children's recovery. The third resource is the Adversity Cycle, which demonstrates how adverse childhood experiences have the potential to impair intergenerational life chances and how frontline workers can create opportunities for deeper understanding and change to help break the cycle. All 3 resources address the profound difficulty of recalling traumatic events, which often have little or no cohesive narratives attached to them, which is why professionals must consider what lies beneath the words, emotions, feelings, and behaviors. Enabling children to tell their own unique, authentic stories in their own way requires safe conditions to acknowledge, open up, and take forward conversations. A trauma-informed therapeutic and strengths-based approach is key. Traumatized children present with multiple layers of complexity and have unpredictable needs and anxieties that have revealed over time. They are often hypervigilant, on high alert for the next danger or threat. This can result in disproportionate reactions to minor incidents. They may also appear withdrawn with internalized rage or fear. As professionals, it's important to understand the roots of these emotions to help support a child who is overwhelmed with unmanageable feelings. Children's immediate reactions to experiencing trauma may include worry, anxiety, separation anxiety, nightmares, difficulty with concentration, increased hyperactivity, increased anger or aggression, withdrawal and low self-esteem and confidence. An understanding of developmental trauma is vital when working with children who've experienced trauma. These children can develop a range of unhealthy coping strategies which they believe will help them survive, but crucially, they also do not develop the essential life skills that they need, such as being able to manage impulses and solve problems. Many children who've experienced trauma are isolated with little or no ability to establish and maintain friendships or self-regulate. They grow up with negative core beliefs about themselves and the world, which can impact on their ability to establish and maintain friendships. For children who've experienced trauma, it may appear that they're displaying immature, disruptive behaviors, but more often this is an indication of their emotional age and explains regressive tendencies that often emerge. They're not being naughty, they're simply experiencing unmanageable, overwhelming feelings, and labeling them will only serve to exacerbate any difficult situations and add to alienation within their peers. Experiences of not being comforted and cared for when frightened affect the development of a child's attachment system, including the ability to trust in others and self-regulate. The very people who are there to keep them safe are often the ones who frighten them the most. Trauma is stored non-verbally, making it extremely difficult for a child to put their experiences into words and process the memory using language. Furthermore, children are frightened to talk about it, in case it might make the situation worse. Memories are not confined to mental images or thoughts and can appear as sensory perceptions, pain, rapid heartbeat, and breathing problems. Professionals who push children to deal verbally with their difficulties risk hurting them further or re-traumatizing them. Children rely on caregivers to regulate their state and arousal, which ensures that they develop emotional regulation. Children who do not have emotionally available, empathetic, and attuned parents will find it more challenging to self-regulate. As professionals supporting children with trauma histories, we must acknowledge and accept the fact that neurologically these children are wired differently, as research shows that childhood trauma significantly impacts brain development. There is no place for blame. Be authentic and real, or you'll fail to connect. Stay calm, patient, and reassuring. Meet them where they are, at their emotional age and state, and not where you think they might be or indeed would like them to be. When children become so distressed that they threaten to harm themselves, clearly you must intervene with caution, care, and understanding. Explain that you cannot allow them to hurt themselves or others, but once they have calmed down, you will spend time with them so they can help you understand how they're feeling. Before doing anything, ask children for permission to help. This gives them reassurance that they do have some control over their lives. Seeking their permission to help you understand them will support the child to feel that they can attempt to explain rather than simply receive your interpretation, labeling, or frustration. Children rarely change until their parent or someone they trust asks, "What do you need right now?" Everyone's experiences and coping strategies are unique to them, so a standard script will not do. Introduce a special buddy support who can be there for them, hold their hand, talk to them. This will serve to lessen their feeling of isolation and the feeling that they don't fit. Explore with the child how their body tells them they're feeling unsafe. This could include butterflies in their tummy, feeling sick, wobbly legs, etc. Encouraging them to tell an adult they will greatly enhance their sense of safety. Develop a relationship with the child and be part of the change that supports recovery. You will learn much about yourself along the way too. Be the difference for these children and get to know them. Never stand over them or respond with frustration. Be clear that it's their behavior that is unacceptable, not them. Treat them with patience, not punishment. Always remember that there is always a reason why children behave the way they do.